Good morning, everybody. There is a new piece of draconian legislation being introduced in the UK, specifically in Northern Ireland, and this is called the Northern Ireland Public Health Bill. It's going through the Northern Ireland Assembly at the moment, and what it will do, if it is passed, is it will bring back into effect in Northern Ireland all of the things that were in effect that took away our freedoms, specifically in the healthcare and medical realm, that we had in 2020 and 2021 through the Coronavirus Act, which was dreadful, and that applied to the whole of the UK. Now, the Coronavirus Act came into effect in March 2020, but it was limited to 2 years. So now most of what was in there has passed and it's gone through a sunset clause. Some things have still remained, and there are issues with them. But the worst things have gone. But what this bill wants to do is bring this back into Northern Ireland permanently, even though there is no fabricated health crisis or pandemic as there was in 2020. I don't believe actually that we had a real pandemic, because the figures show that the average age of people dying from COVID, if COVID actually existed, was 83, and it was a tiny fraction of 1% of the population. So there wasn't a real pandemic like you had pandemics of cholera and smallpox and things in the past. I mean, it was most of what was called COVID was other things. In fact, we know that the flu figures went right down to zero, and the COVID figures went up exactly in the mirror to how flu had disappeared. So a lot of COVID was just flu, misdiagnosed and rebranded. But still, they brought in all of these draconian regulations and pieces of legislation back in 2020. But that was for a temporary period. This would be permanent. And the idea, I think, is to roll this out in Northern Ireland. And they're going to hope that there's not much resistance to this, although resistance is already building and people are becoming aware of this. So I think that lots of people will respond to the consultation on this. But the idea is that they will get this through in Northern Ireland, and then this will be a precursor to rolling out similar legislation in England, Scotland and Wales as well. What does it actually do, this Northern Ireland Public Health Act? Well, like the Coronavirus Act, it wants to give state agents the power to mandate vaccines and health treatments. So if they deem that there's a pandemic, then someone can come along and forcibly inject you with whatever they want to inject you with, or open your mouth and force a pill down your gullet. Now, this goes against all principles of freedom and medical ethics. We have medical autonomy. We have informed consent. That is our right. We do not have to take any medicine or vaccination, in inverted commas, if you still call them that, against our will. We have to be informed exactly of what we're getting, what we're taking, what the side effects are, what the negative effects are of anything that we are given by any doctor, any procedure being done, any state agent. And we have the right to refuse any treatment. What this bill does is it says you won't have that right anymore. If there is a state of emergency, the government can send someone to override your fundamental freedoms, your informed consent, your medical autonomy, and inject you with something against your will. Now, of course, that goes against our foundational fundamental freedoms and against our common law. It is unlawful, but they want to make it legal. There's obviously a difference between legal and lawful. It will be unlawful in common law. They still don't have the right to do that, but they want to bring in this legislation to try and force people to do this, and most people won't know the difference. They also want to make it so that government agents will be able to detain you or quarantine you if they suspect that you have a certain virus or you've been infected with something, if there's a pandemic, even as a precautionary measure. If they say, oh, the people in this area may have been exposed to something, they can cut your neighborhood off, stop you from coming in or out with these 15-minute cities and gantries and all these kind of anti-freedom paraphernalia, anti-movement paraphernalia that people are bringing in all over the country through the climate agenda. You see how it all dovetails together. The climate agenda is bringing in restrictions on movement, and then the government can say, oh, there's a pandemic emergency, and use the paraphernalia that they've put in place to restrict you from moving in and out of your own neighbourhood, and then flood that with agents in order to detain you, quarantine you, inject you, etc. This is how things are working together. They say that they'll be able to forcibly enter premises, not just like the police can do at the moment if they suspect that there's a crime, but just if they suspect that you may be ill or may have been exposed to an illness, whether or not it exists. They can forcibly enter your premises, they can forcibly detain you, take you away and quarantine you, and also stop you from going to work and stop your kids from going to school. Those are the measures which are contained in this Northern Ireland Public Health Bill. And if it becomes an act of the Northern Ireland Assembly, it will be active legislation in Northern Ireland. Now, needless to say, this is absolutely abhorrent and it undermines all of our freedoms. It is tyrannical, it's totalitarian, and it comes from the globalists and their agents acting at local level, obviously acting here in the Northern Ireland Assembly. And it is all to do with the plans that are being put in place at the moment with the World Health Organization. Their changes to the international health regulations, they've just been amended. They've tried to bring in a pandemic treaty, but that didn't work. But still, they're getting people to put this legislation through individual parliaments and governments in Northern Ireland is a nation, but it's, obviously part of the United Kingdom. So it's sub United Kingdom level, it's sub Westminster level, but they still want to bring it in there. In various provinces and also various local governments, where local governments and metro mayors, etc., have the power to do this because they're being given the power to do this, with the whole global to local agenda, where power is being devolved. But the people they're being devolved to in the local areas are more globalist or as globalist and as draconian and totalitarian as the people right at the top of the chain in the UN and the World Health Organization, and the people above them in the pyramid that you don't see. So there's a consultation about this, and the closing date for the consultation is the 14th of October. Now, I'm going to link into my YouTube channel here, if you're watching this on YouTube, the link to the piece written about this by the UK Medical Freedom Alliance, and they have a whole article on this that says similar things to what I've just been saying here in the video, but they also have a link to the consultation, so you can read about it on their website. Click on their link to the consultation so you can fill it in and object and oppose this, as is your right, your democratic right to do so. Every bill has to have a consultation so they can hear the views of the public about this. So you can look at that, read the article, click on the link to the consultation, fill in the consultation, oppose this and say, we do not want this bill to go through because the government should not have the powers to override our fundamental freedoms, our medical autonomy, and to take away informed consent. This goes against every medical ethic that we've had since the Greco-Roman times, so with the Hippocratic Oath, etc., and our fundamental freedoms. It shouldn't come into being. And, the fact that, this is happening in the United Kingdom, which has been a bastion of freedom for, a millennium, it just shows how much the globalists are pushing their agenda to bring in tyranny, global governance, to get everyone working in lockstep together and to undermine our freedom. So fill in the consultation, object to this, and then they will know that it is not wanted, because they've already got an army of NGOs and globalists waiting to fill in all kinds of consultations like this. They're already going to have 100, 200 individuals, NGOs, maybe more, maybe 1,000 to fill in the consultation and say, oh yeah, this is a great idea. We need to keep the people safe. Well, then it's not keeping you safe. It's actually making you unsafe, because it's giving the governments the rights to come and mess you up by injecting some experimental gunk into your arms. That's not keeping you safe. That is actually something that is very dangerous and hazardous to your health and your freedom. So they will have an army of people ready to go to fill in the consultations in the NGOs. This is what they do. This is why, the whole other thing, getting on to a slightly different thing, is why I'm against government funding NGOs, because the governments fund NGOs, and then NGOs fill in consultations and they fill them in the way the government wants them to fill them in. And then it's a vicious circle of them being funded to support the government's position and lobby the government through the consultations. I mean, it's completely corrupt. Consultations should be free and fair. They should not be filled in by NGOs that are paid by the government to fill them in. They pay NGOs to lobby the government to get them to do what they want. I mean, the whole thing is utterly corrupt, and it needs to be smashed and broken, that system. But my point is, there are many, many people who are going to fill in this consultation, who are paid to fill in the consultation, either from the government or from NGOs linked to the government, to say that they want this to become law. We need more people to fill this in, to say that we don't want this to become law and that this needs to be thrown out because it is utterly disgraceful and totalitarian, and it shouldn't be, it shouldn't even have seen the light of day. So there you go. That's what's going on in Northern Ireland at the moment, in the UK, part of the UK, with this public health bill. And of course, as I said, it's very important, because if this gets through in Northern Ireland, they will bring in similar legislation in the Senedd in Wales, in Holyrood for Scotland, and in Westminster for England as well. So we need to nip this in the bud right here in Belfast before it sees the light of day and gets into the statute books anywhere in any time. So thanks for listening. Please fill in the consultation. Look at UK Medical Freedom Alliance's link, and God bless you all. Thanks for listening.